Another question that comes up a lot is, when can I wear a hat? When can I cover my head? So as a surgeon, I wear a skull cap. But what I did for those first few weeks, actually for the first week and a half or so, I just wore like the bonnet one. So I know people can't walk around with that, and people can't walk around with a surgical cap on. So the next question is, when can you actually wear a hat or a baseball cap? The real answer is, I would still be careful doing that. I get some patients who have done that pretty soon after surgery because they don't want people to know or see that they've had this done. And what can happen is, if that hairline is rubbing where you transplanted the hair, where the actual rim of the cap goes, you may kind of disrupt some of the follicles. So my answer to you would be, minimize that. And the way to take care of that is get your hair cut short way before surgery, so people are used to seeing you that way. Keep it like that. And then when you have the hair transplant done, after that first week, it's really not as noticeable to other people. And I think it won't be something that you'll have to feel like you have to cover up with a hat. Again, that's just my personal opinion, my personal experience. If you read the literature, they say you can kind of wear a hat back soon after surgery, within a few days. But that really depends on where your follicles have been transplanted. And if it's kind of in the front hairline and you're wearing a baseball cap, even if you keep it loose and there's some rubbing that's going to go on, and just like I said, we've seen some patients lose some follicles after surgery. So I'll leave it up to you. If you can wear a cap without touching the hair follicles, then it's thought to be okay to do. But I'll tell you, I would try not to do it. And the way I'd get around it is cut my hair short before surgery, let everybody see it, get used to it, so it's not something that they freak out when they see after surgery.